Sit up. I know. That's much better. See, then you're you see yourself? Oh, we don't want her to come over. No. That'd be bad. You stay here.
Hi, I'm Kim with Just Medicare Advisors Media, and we're so excited today to be joined by the CEO, Leslie Slay, and Medicare Miles. Y'all welcome.
Hi, Medicare
Welcome,
Miles.
welcome.
Hi, how are you guys? All right.
Good. You're so
play.
so
Go
glad
learn
to
more
see
about
him.
Medicare.
We wanted to jump on today and let you see some of the faces behind Just Medicare Advisors. And we're so happy that Leslie could join us to just update us on a few things. And before we get started, we want you to really meet her and understand why she is qualified to do the work that she's doing. And so, Leslie, tell everybody just a little bit about your background and what you bring to the table as a Medicare advisor.
That's a loaded question, but thanks, Kim. So hi, everybody. My name's Leslie Slay, and my background has been in health insurance for over 25 years. So before Just Medicare Advisors, I was an employee benefit consultant. And what that meant was that I work with large companies and help those companies find healthcare solutions for their employees. So that is very complicated and lots of fun, but obviously you deal with insurance carriers and everything that goes with that, from claims to provider networks to benefits to costs. So as I was kind of exploring the next version or what I wanted to do next after that career, I really got focused on, people aging into Medicare, basically leaving their employer-sponsored coverage and having to kind of go into this Medicare space that I thought was honestly really confusing. A lot of the marketing is misleading, and I thought that I could bring a sense of real education and learning and professionalism to that decision-making process. So that's kind of a little bit about me. You met Miles when we first started. So I actually have two different Miles. So I have two sheepadoodles, have four boys. That brings a whole bunch of knowledge with it. I'm married, have a great, family and life. And I love what I do, which is helping people find the right insurance solutions.
Well, one of the things I think that you do so well is the education piece of helping people understand what is very complicated. And one of the things we've been seeing a lot lately is there's so much confusion, and a lot of people it seems to be a big hot topic, especially on social media, about the Medicare Advantage scam, people thinking it's a scam. So we thought we'd ask you, since you are an expert, tell us about that. Why do people think Medicare Advantage is a scam?
Well, I think previously there's been a lot of I'll call it bait and switch. Medicare Advantage plans are great, but they're not for everybody. First of all, a real big issue with Medicare Advantage plans is that, you're limited to the doctors and the providers that you can see. They have to be in a network in the area in which you live, right? So when you see commercials on TV that tout extra benefits like a cash card or other things that Medicare Advantage plans have built into them, like extra vision benefits or hearing benefits. And again, Medicare Advantage plans are great, but oftentimes you're going to call that 1-800 number. And then all of a sudden you're going to be told, well, you don't qualify because you live in a zip code that doesn't have a provider network available to you in order to enroll in Medicare Advantage. So I think what I mean by bait and switch is that I think a lot of people get excited because they hear about these benefits that are part of Medicare Advantage or MA plans. And then they make that phone call and they're told, nope, not for you. So, the whole little itty bitty fine print that not all plans are available and not all in all areas really applies here, right? And so I think people feel let down by some of that.
That makes sense. I think another thing we've been hearing a lot about is just, everybody's been bombarded with the commercials they're seeing on TV, but there's still a lot of confusion about what is the difference between all the different enrollment periods, and what's the difference between annual enrollment and open enrollment, and what do I do if, do I have to change all the things? And so maybe you could tell us a little bit about that.
Sure. So I'd answer that question in a couple different ways. First and foremost, if you are enrolled in Medicare and you like your plan, you like the doctor or doctors that you go to see, you feel good about the hospitals that are around you, the deductibles or copays are affordable. And you would have recently gotten a notice that would have given you information about 2024 premium. So not only are the copays and the deductibles, if and when you might get sick, are affordable, but also that monthly premium is affordable. Then you don't have to do anything. Sit back and just mute those commercials when they come on TV, right?
Mm-hmm.
Do something else. Or laugh with me when you see them, right? Now, if you answer no to any of those questions, if the plan is not meeting your needs, or you want to explore other options, then this is the time, October 15th through December 7th every year, that you have an opportunity to look at different plans that are available, and any change that you might make would be then effective January 1, right? So that's if you're on straight old-fashioned Medicare, which is just Part A and Part B that's provided by our government. You might have a Medicare supplement plan if you have traditional Medicare. You might decide to change who your Medicare supplement provider is. You might go from, name the carrier, United Healthcare to Aetna or to Cigna, or from Cigna to UHC, right? All the benefits and the networks change every year. So it is kind of important to look at that. If you have a Medicare supplement plan and you're interested in looking at Medicare Advantage plans, now is the time to look at that as well, right? Maybe you've had Medicare, for example, my mom has traditional Medicare with a Medicare supplement plan. 2 years ago, we looked at her benefits again, and her Medicare supplement plan got really expensive for her. And so we looked at her doctors, we looked at her medications, we looked at a whole bunch of different things, and we transitioned her to a Medicare Advantage plan. Why? It was less expensive for her each month from a premium perspective, and she got more benefits that she needed at that time 2 years ago. So this is now that open enrollment time that you can make those changes annual enrollment time. Even I misspeak. I know, go figure. In January, you're going to see open enrollment period. And that's really for anyone that just has a Medicare Advantage plan to change Medicare Advantage plans. So I think that's where a lot of the confusion comes in, because it's like you just went through it, and then I can go through it again. Right. I just encourage everybody, if you're not sure, call someone, call us, call your trusted advisor, call somebody that is an expert in this space, and they'll let you know when you can make those changes in your programs.
I love that about you, that you really are available for people to call and to ask questions. And I think so many people are afraid to call because they're scared somebody's going to pressure them. But I love that you're willing to talk to anybody, help them navigate what seems to be quite confusing.
Well, you know what? I hate that myself, right? I hate somebody calling me or me calling somewhere because I have a question, and then I try to get, someone tries to railroad me or upsell me or not let me say goodbye. Hate that. And all I was just doing was just trying to get some answers, right? So again, the whole premise of why I even started this organization was to be a resource. And so if someone just has a quick question, we're licensed in many, many states, but a lot of the questions people have of us are generic. They're not necessarily state-based. They're just, overall Medicare questions. You know what? I believe in karma. And if you just do the right thing and you help people out, if in fact they need something and they want to explore purchasing a program or having us help them do some more advising, great. But otherwise, information shouldn't be, that hard to get. And that's just our policy, right?
Love that about you. Are there anything that people should be aware of, the changes for 2024? Is there anything that you can talk about that of upcoming changes that might need attention?
Yeah, no, not necessarily anything for 2024. I mean, we just had insulin in 2023 go to a lower copayment depending upon the plans that you're on. So that is much more affordable for a lot of individuals. We saw the benefits pretty much stay the same. We have seen, especially on the Medicare side, we have seen some premiums go up. We've seen more plans added. So even if you're with a carrier and you were happy with the plan that you purchased, a lot of them are bringing additional programs and plans online. So you probably want to talk to your Medicare insurance person around just, hey, is this still the right plan for me? And has my carrier brought anything else around that I may want to look at? You are going to see more medications next year be more affordable. And I know there's been a lot in the news on that. And that's with just the Medicare purchasing power, and that will come into play. So you should get some relief there, depending upon, again, the medications that you take. The star ratings just came out, and the star ratings are like Yelp, right? And that's a whole process I don't think we'll have time to get into today, but I think we just posted, sometimes I forget. So I think we just posted a video or some content on our website as to what the star ratings all mean. So if you're interested in learning more about that, check out our website, go to some of our YouTube videos, and we'll explain all that. But those just came out in early October. So if you want to understand how CMS feels about your plan and your carrier, I'd take a look at the new star ratings.
Exactly. I was just going to mention that we do have some great videos. Yeah. There's also a really great one about how a broker gets paid, which is really interesting. I think a lot of people don't know that and don't understand that. So thank you, Leslie, for just jumping on here with us today. And it was so good to see you and see Miles. And please don't hesitate to reach out. Also check out justmedicareadvisors.com. Lots of resources there. And our socials are also Just Medicare Advisors. And the phone number is 702-613-0991 if you want to call and talk to Leslie. So thanks again, Leslie, and thank y'all for joining us today. Remember, justmedicareadvisors.com. Just Medicare, it's all we do.
All we do.
We hope to see you again.